Hello and welcome to my future scanning project. Today I will be talking about innovations in the health and medicine industry. Some of the key concepts are going to be past innovations, present innovations, and finally future innovations in the health and medicine field. So first I'm going to discuss some innovations from the past of healthcare. I'm going to just highlight a few major things that happened throughout the history of healthcare, and then on the next few slides, I'll go into more detail on a few of them. So first, in 100 BC, Diocles wrote the first anatomy book. In 1816, the stethoscope was invented by René Laennec. In 1887, the first pair of contact lenses were invented. And in 1978, the first test tube baby was born. In 1996, the first clone was successful, and it was a sheep named Dolly. And then finally, in 2006, the first vaccine to target a cause of cancer was created, and it was cervical cancer. So now I'm going to talk a little bit more about the first test tube baby. The first test tube baby was Louise Joy Brown, who was born on July 25th, 1978. She was conceived through vitro fertilization in Manchester, England. Her parents are Leslie and Peter Brown. In order for Louise to be conceived, Leslie underwent an experiment where an egg was removed from one of her ovaries and then combined with her husband's sperm in a lab. And then once the embryo created, it was implanted into Leslie's uterus, and then she was able to carry Louise to term and give birth to her. And then finally in 2006, Louise gave birth to a boy of her own, and her child was conceived naturally. So as you can see on the side of the screen, there's a picture of Louise as a baby and what she looks like fairly recently. Next, I'm going to talk more about the first clone, which is a sheep named Dolly. So in 1996, the first clone was successful, and Dolly the sheep was born at the Roslin Institute in Scotland. She was named after Dolly Parton. In order for Dolly to be cloned, they took a mammary gland, or a mammary cell from an udder of a 6-year-old lamb. The cells were cultured using microscopic needles, which was actually originally used as one of the first methods in human fertility treatments. So once these mammary cells produced a bunch of eggs, they were implanted into a lamb, and then 148 days later, Dolly was born. And as you can see, there's a picture of Dolly on the screen, and then a diagram just kind of showing how the whole process worked. Next, I am going to talk about the first cancer vaccine. So it is called Gardasil, and it prevents 4 different strains of HPV, which is the most prevalent sexually transmitted disease. It was originally used for girls and women aged 9 to 26. However, it's currently HPV vaccines are being given to males as well. Cervical cancer currently kills 3,700 women each year in the United States alone, and obviously it is way more than that worldwide. So you can imagine what a vaccine like this would do for helping reduce those numbers. During clinical trials, the vaccine was 99% effective, which helped it get FDA approved very quickly. Now I'm going to talk about some present innovations in the medical field. So again, I'm going to highlight some of them, and then I will go into more detail on what they are and things like that on the next few slides. So we have electronic health records, remote care and telehealth, virtual reality, LASIK eye surgery, and precision medicine. So first I'm going to talk about electronic health records, and they're the same as paper health records, they're just being kept electronically. So electronic health records provide information on patients faster and more efficiently than paper records. Nurses and healthcare providers are able to instantly pull up an EHR and view their patients' entire medical records. They increase convenience, reduce confusion between professionals, and less information is lost. And as you can see in the pictures, these are just some examples of what an EHC would look like. And next, I'm going to talk about remote care and telehealth. This is basically when you visit the doctor via the internet, such as like Zoom or something like that. This is something we're all very familiar with now because it has become way more prominent because of the pandemic. It increases convenience while maintaining high quality care, which is something they're still working on, making sure that the quality of care is the same, whether you go to the doctor in person or if you visit the doctor through a telehealth appointment. Some things that are really helpful for doctors during remote care and telehealth are wearable devices because they allow for remote patient monitoring, and physicians can receive data such as heart rate, calorie intake, and other vital signs. An example of this can even be as simple as an Apple Watch because it does monitor the heart rate and stuff like that. Now, it doesn't exactly immediately send that information to a physician, but it is an example of a wearable device. Using telehealth and remote care is extremely helpful for patients who are unable to make it to the doctor just because they live maybe in a more rural area and they don't have as much access to doctors. They can do a telehealth appointment and be able to see better doctors than they might have in their local area. This also helps with the affordability of care. A lot of people can't afford to actually go into the doctor's office, so having an option to do a telehealth appointment definitely reduces a lot of costs for the patient. Next, I will be talking about virtual reality. Again, virtual reality is something we're all becoming more and more familiar with. This is not something that is exactly new in a sense. It's been around for kind of a while, but it's becoming more and more prevalent in today's culture, and it is being used in the medical industry now. So it's extremely beneficial for surgeons because they're able to practice surgeries and things like that, and they can go through the surgery multiple times, and it'll seem as real as if they were doing it on an actual patient. This way they can just practice and try new things and stuff like that without obviously having to do it on a patient and risking harm to a person. It is being used in psychiatry for people with PTSD and other phobias. It helps them face those phobias and start to expose themselves to certain situations while still being in an environment they trust and they feel safe in. It's also beneficial for medical students because they'll get a better understanding of the body and everything like that, and the sense that they're able to see a full 360 model of the anatomy and everything. And like a surgeon, they can practice surgeries, they can practice IVs, they can practice anything they may need to know throughout medical school. Next, I will be talking about LASIK eye surgery, which again is becoming more and more prominent in our culture, and more people are getting this surgery. So basically, LASIK eye surgery is a surgery where a laser is used and it reshapes the cornea, which allows for better vision by fixing any defect or anything that a person may have, which was causing their impaired vision. So it's more affordable. While yes, the surgery is expensive, it's way cheaper and way more affordable than having to buy contacts and glasses constantly. So over time, it is more affordable in the long run. It's also easier for physicians. If they perform a LASIK eye surgery, it's easier for them to keep up with the patient's vision and stuff like that because they won't have to constantly be making sure prescriptions are adjusted and stuff like that, because the amount of appointments and things like that are becoming slimmer and slimmer, which is a huge problem in the United States currently. So it's easier for a physician to perform LASIK eye surgery and feel comfortable knowing that the patient is seeing properly without having to worry if only meeting once a year or something like that is enough for their prescription to match their current eyesight. And like I said, it is performed with a specialized laser that modifies the eye. Next, I will be talking about precision medicine. And precision medicine provides disease treatment and preventative measures based on an individual's environment, lifestyle, and genetic makeup. Its main goal is to provide a more individualized care. It reduces time and money, recognizes patients' individuality, and focuses on diagnosis based on genetic testing. Precision medicine is extremely important because for a long time, the healthcare industry has had a one-size-fits-all approach to medical care, and that is not beneficial to many people because not everybody's the same. We all know that. And so it saves, like I said, it saves time and money because some patients, you'll come in and the doctor knows what the issue is and has the best treatment for that patient in mind. However, with the medical system being a one-size-fits-all approach, they have to go through all these other processes and possible treatments that may not work for that patient, which again would be a waste of time and money for that patient. So using precision medicine will allow doctors to provide the treatment they feel is best for that individualized patient. This precision medicine also focuses on genetic testing. So diagnosing people based off their genes and finding treatments based off their genes is more beneficial to the patient because it will be more individualized and it'll be more geared to their body and their genetic makeup, which will again help their healing process be faster, be quicker, and more efficient because it is specialized to them and no one else. So finally, I will be discussing some future innovations in the health and medical industry. Some of the ones I will be talking about is 3D printing, brain-computer interfaces, and digital tattoos. So first, I will be talking about 3D printing. And 3D printing is something we are becoming more familiar with. However, in the medical industry, it is not being used to the full extent yet because they are still working on improving the technology, but it will reduce labor costs significantly. It's able to provide precise and more custom designs. There's tissue engineering. In order to use 3D printing in the medical industry, they take stem cells from their patient and they print organs and skin grafts and plasma to whatever that patient needs. That's what they print using their own stem cells, which will help with anti-rejection and things like that. So patients' bodies will be more accepting to the new organ, the new skin graft, the plasma, whatever it is they're needing to receive. Like I said, the technology is not fully developed in the medical industry. So one of the things that they're working on trying to figure out is organs. Organs have not yet been printed and used, but are expected to be coming in the next few years. They have been working on printing organs and things like that. They've just never been fully viable for a patient to use yet. Regarding the precise and custom designs, that has to do mainly with people who are in need of prosthetics. They're able to get a more comfortable fit because it's based solely on their body, which kind of goes back to the precision medicine. This stuff is focused more on the individual patient instead of a one-size-fits-all kind of deal. Patients will be able to make sure that their prosthetic fits perfectly to their body and no one else's. Next, I will be talking about brain-computer interfaces. So current examples include cochlear implants and visual cameras. The visual cameras convert light into electrical signals, which allow the person to see certain images. And then cochlear implants, we're all very familiar with cochlear implants. That helps a hard of hearing person be able to hear. And so some things like the cochlear implant and vision camera have been in use for a while. However, they're working on improving the technology. So in the future, they'll be able to do things like inserting a chip into your brain that'll give you a perfect sense. So some of those examples would be like perfect sight, being able to see in the dark, perfect hearing, unlimited memory, and controlling computers. Some of these are already being used, but extremely, extremely rarely. There was an example of a 30-year-old man. He was paralyzed completely, but with this technology, his brain was basically like connected to a computer, and the computer was able to help him move all four of his limbs with this technology by reading what his brain was wanting to do. So you'll also be able to communicate through these. If someone is mute, they'll be able to communicate with these computer interfaces because there'll be a chip in their brain that will allow their brain to communicate with the computer to tell the computer what they're wanting to say and things like that. And the computer will be able to relay that information to the outside world. Next, I am going to talk about digital tattoos. Currently, there are shirts with sensors embedded in them that allow doctors to monitor athletes' heart rate, such as like athletes' heart rate, breathing, and calories burned. So it's very similar technology to those shirts, but obviously it is a tattoo and not a article of clothing. So these are invisible skin patches and tattoos. Currently, they aren't entirely invisible like you see in the picture, but that's what they're working towards in the future. They're extremely flexible and waterproof. So they move perfectly with the skin. They don't irritate your skin or anything. It's just like an actual tattoo. So these digital tattoos are embedded with tiny electrodes that are able to record and transmit any information through your body. Another example of like this very similar technology is pills. They have these pills that release little electrodes all throughout your body, and they relay information the same way these tattoos do. So using these tattoos allow healthcare experts to monitor health conditions such as a heart arrhythmia, heart activities of premature babies, sleep disorders, and brain activity. The electrodes that are in the tattoo track different vital signs and relay the information to both the patient and the physician. That happens through an app on your mobile device. You'll be able to monitor your own vital signs along with your doctor, which is extremely beneficial for people who are at high risk of stroke, high risk of heart attack, anything like that. Doctors will be able to see what's happening immediately. And if you know anything about heart attack and stroke, a lot of them, if they're not treated within so many minutes, can be fatal. So having technology like this, where the patient is being monitored constantly, can save hundreds of thousands of lives. Some interesting things is that aren't exactly happening right now with these tattoos, but are looking like they will be happening very soon, is these patches will be able to track your muscle movements, not just like basic vital signs like heart rate and things like that. It'll be able to track each muscle in your body. And then this can also be very beneficial for speech language pathologists and anything going into that industry, because if it is applied directly to the throat area, it'll be able to track muscle movements within the throat area and your speech patterns, which, like I said, can be helpful to a speech language pathologist as they're trying to help a patient speak again or help a young child learn how to enunciate words and improve speech impediments and things like that. If they're able to monitor speech patterns through a technology like this, they'll be able to better understand that patient and what that patient needs. Eventually, these tattoos will be able to track specific brain signals. However, this is an aspect of technology that is still years and years away. If this technology can track brain signals, it'll be able to help doctors better understand what is causing certain illnesses and certain problems in the body, because they'll be able to see what the brain is telling the body to do and stuff like that, which obviously would be very beneficial. Thank you so much for listening to my presentation on innovations in the medical and healthcare industry.